Ever wondered why menopause hormone treatments spark such fear? Is it the risk of heart disease, stroke, or perhaps breast cancer? These concerns have been prevalent for years, causing many to avoid hormone treatments altogether. But is this fear justified? Before we continue, like, comment, share, and subscribe. Enter the Women's Health Initiative study. This large-scale, long-term national health study was designed to address the most common causes of death, disability, and impaired quality of life in postmenopausal women. It focused on cardiovascular disease, cancer, and osteoporosis. The study began in 1993 and enrolled more than 160,000 women between the ages of 50 and 79. It was one of the most definitive, far-reaching studies of postmenopausal women's health ever undertaken in the U.S. The Women's Health Initiative study was divided into 3 clinical trials and an observational study. The trials were designed to test the effects of hormone therapy, diet modification, and calcium and vitamin D supplements on heart disease, fractures, and breast and colorectal cancer. So what did they find? The key findings of the study were a mixed bag. On the one hand, it found that hormone therapy increased the risk of heart disease, stroke, blood clots, and breast cancer. On the other hand, it also found that hormone therapy decreased the risk of colorectal cancer and fractures. The study also found that the risks and benefits of hormone therapy can vary depending on when women start taking hormones. For instance, for younger menopausal women under 60 or women who are within 10 years of menopause, the benefits of hormone therapy for relief of menopause symptoms can outweigh the risks. In the light of these findings, the fears surrounding menopause hormone treatments may have been largely overblown. The initial concerns that led to the widespread abandonment of hormone drugs may have been exaggerated. So, what does this mean for you? If you're a younger menopausal woman suffering from symptoms like hot flashes and night sweats, hormone therapy might be a viable option for you. But as always, it's crucial to have a detailed discussion with your healthcare provider about your personal risks and benefits before starting any new treatment. Remember, knowledge is power. By understanding the facts, we can make informed decisions about our health. And that's something we can all benefit from. This video is for informational purposes only. Like, comment, share, and subscribe to Top Trending Health News Scoop to see more videos like this. Until next time.